Shri Krishnaji Kurti sir, all the staff members of the Nagaraj Institute of Yoga, my friends, ladies and gentlemen. Very good morning to all of you. I am Dr. A.K. Joshi speaking from Bangalore. A stands for my name Arvind and K for my father Krishnacharya. Incidentally, the namesake of our Guruji, Krishnaji Kurti sir. On the eve of celebrations of the International Day of Yoga carried out all over the world, I wish to share a few of my feelings and experiences with all of you. I joined Nagaraj Institute of Yoga along with my wife Srimati Malini Joshi about 4 months ago. Since then, we have been attending daily without fail. And I am very happy to inform that both of us have reaped plenty of benefits during this period. I have osteoarthritis both the knees, as a result of which I could not squat on the ground for more than 5 to 10 minutes. And after attending these yoga sessions, I am able to sit in Sukhasana for 1 to 1.5 hours in the morning and another 1 to 1.5 hours during puja time. This is a great achievement, and I feel it is because of the systematic and progressive strengthening of hamstrings as well as quadriceps muscles during the yoga sessions. My wife also has a osteoarthritis both the knees. Along with that, she has a mild blood pressure and she is a known hypothyroid patient. In the last 6 to 8 years, she underwent 3 to 4 surgeries. First one was for a right rotator cuff injury, right shoulder. Second, for compound fracture, right foot. Third one was in the back for a low back pain radiating down the lower limb. She has the instrumentation fixed from L1 to S1 in her back. But in the last few months, she is far comfortable. Her intake of medicines have come down, though she has to take certain medicines for BP and thyroid regularly. All the credit goes to Nagaraj Institute of Yoga and Shri Krishnaji Kurti sir. A few words about my switching on to the other schools of medicine. Though I am a graduate in allopathy with the MBBS, I am open in my mind to get the relief from any other alternative school of medicine. Let it be homeopathy, naturopathy or Ayurveda or any other source. As long as we get benefits for our patients, I welcome it. In the last 1 or 2 decades, the standard of medical education has come down. The clinical acumen, what was the mainstay of a medical profession, is slowly eroded, and unwanted, unnecessary investigations and surgeries have left the people with a bad taste. And equally, the patients are also responsible. These days, patients have no patience at all. By the time they go home, they expect the relief from the medicine. However, we try to explain there are so many natural ways of healing with most of the ailments, but they don't listen to it. They say probably this doctor doesn't know so many things. And all these practices have led us to some unwanted things in our medical practice. Anyhow, that is a different matter altogether. Let us not dwell more on that. We have a wonderful teacher in Krishnaji Kurti sir, who has a lot of patience and a great concern for the welfare and health of the people at large. He cares not only for his students, even for the whole mankind. I have seen several yoga schools and institutions. I would like to enumerate here unique features of Nagaraj Institute of Yoga which are not seen elsewhere. I have about 12 points to elaborate. The first one is practical implementation of theoretical principles of Patanjali Yoga Sutras in a very meticulous way. For example, Sthiram Sukham Asanam is the sutra he has taught us. That means to say, whatever posture we adopt during the asanas or exercise should be stable and comfortable. He doesn't insist only you do this asana. whatever asana is comfortable and stable to you, you do it. That's a very good principle. Second one is Nirantara Prayatna Purvaka Shaithilya Samapatti. While doing stretch exercise, we do feel discomfort and pain sometimes, but we have to continue them. Continue Nirantara for a long duration. Then only we strengthen the muscles and get the desired benefits. Another principle he always says is Mana eva manushyanam karanam bandha mokshayoho. He has a very unique way of healing ailments. His approach is always holistic. This saying means most of the diseases have their root causes in our mind. Our mind or mana is very fickle in nature, that is chanchala. It doesn't stay at any place for more than a certain duration. We have to deliberately control it. That is why this saying, Mana eva manushyanam karanam bandha mokshayoho, is taken from a Tritiya Skanda Bhagavata, where Kapilanam Paramatma was advising his mother how to control mind. It is comparable to lock and key. If you turn the key towards right side, it gets open and we are open to so many worldly things and unwanted attractions. If you turn the same key to the left side, it gets locked and we can concentrate and pursue our goal with a determination. So he leaves a choice to us whether we want a bandhana or a moksha from the diseases. If you turn towards right, you continue to live in bandhana. And if you turn towards left, you are released, you attain moksha from the diseases. That is why at the end of morning sessions, he always asks us, please investigate whether your mind was wandering on other unrequired places or was it concentrated on the prayer and the meaning of the prayer. This has helped us to mend our ways in a very positive way. Next, we pray Narsim Bhagwan to see that all the enemies in and around us, both internal and external, are warded off. Here, I would like to thank our colleague, Sri Jagannathan sir, for chanting Mani Sukta in a very beautiful and impressive way. Saswara Veda Mantra, chanted properly, will have a great impact and very effective results. Next, we pray Rudra Bhagwan with the Lingashtaka. Rudra Bhagwan is known as a god of mind, Manoniyamaka Devata or Manobhimani Devata, who prepares us to face any challenges we come across in our daily life. Nagaraj Institute of Yoga has turned all the Patanjali Sutras of yoga into very simple, easily practicable techniques suited to benefit all types of people, the young, the middle-aged and the aged. Sri Krishnaji Kurti sir has devised well-planned, well-designed techniques to suit not only the diseased people but also to the healthy people. The he offers exercises for all parts of the body, head and neck, shoulders, upper limbs, lower limb, chest, abdomen, etc. To cover whole the body. And we always insist that these movements have to be done in a slow, deliberate and rhythmic moments so that we get the benefit out of those in a very positive way by strengthening the muscles, tendons, ligaments and thereby attaining higher immunity. It also provides increased blood supply and oxygen to the tissues of the body and thereby we get stronger and stronger day by day. Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi are 8 organs of the Ashtanga Yoga. About Niyama, he has taught us the ways of a Shaucha. He has taught us Jiva Mula Shodhana, Jiva Shodhana, Danta Shodhana, Netra Prakshalana, Netra Snana, Jalaneti, etc. Here he has provided us with a beautiful video demonstration so that we carry out all of them in our daily life. And it has been found very useful with a good results. Here I would like to explain a few minutes about fungus. Fungus has been in the news for the last several months. Black fungus, yellow fungus and white fungus. You must have been reading in newspapers as well as seeing the video. Fungus is basically an infection grown in a moist area. In a common practice, you must have seen the fungus growing on a stale foods kept overnight. A bread piece or any other food item grows fungus the next day because it's moist. We have a lot of moist surfaces in our body, right from the nose, tongue, throat, and down the food pipe, down the windpipe, intestinal tract, etc. So everywhere we have to clean them with the water, which makes them more moist. But we need not get panicky or worried about it, because in our institute we daily practice all types of pranayama with the preparation, blowing through the nose on right nostril, left nostril and on alternative nostrils, and pressing the tip of the nose, forcefully blowing out. All these procedures will make the whole tract clean and dry. Route of entry of fungus or any bacteria is through the nose. Once you keep the nose and mouth clean and dry, there is no necessity of worrying about fungus at all. And these fungal growths have been seen in the hospitalized patients with the uncontrolled diabetes and respiratory condition like bronchial asthma or emphysema, etc., where the person will not be able to do the cleaning himself properly. And other culprits may be the tubes used in suction apparatus, cylinders, oxygen cylinders and ventilators, etc. Another noted finding among the ENT surgeons, they have advised us, some people have been taking hot fumes, though it is beneficial, but throughout the day, as a result of which they have burnt the mucous membrane in the nose and as well as tongue and throat. So the eroded surface will breed fungus. So we should adopt all these procedures properly, knowing the techniques and their meaning. Unique feature of Nagaraj Institute of Yoga is we are carried away on a holy trip once in a fortnight on Ekadashi days. The great quality of a teacher is in carrying the masses along with him. Sri Krishnaji Kurti sir's narration is so impressive and touching our heart that all of us feel we are on a virtual trip to Pandharpur on every Ekadashi. Having a dip in Chandrabhaga river with a Snana Sankalpa, entering the main temple of Panduranga Vithala, having a darshan of Panduranga Vithala, offering our prayers, receiving his blessings and prasada, coming back to yoga class is a wonderful and memorable experience all of us have felt. The packages offered by Nagaraj Institute of Yoga, I told you it covers all the parts of the body, but they are very, very comprehensive, very simple, easy to practice, and most important, result oriented. He has been saying again and again the pranayama, all varieties of pranayama preceded by Kapalbhati and Agnisar Kriya with the holding and Ashwini Mudra, they go a very long way in strengthening all the parts of the body, increasing the immunity and resistance. Special mention has to be made here about Sri Krishnaji Kurti sir. He pays individual attention to every one of us. We have more than 500 in number, but even then he knows them by name and he remembers their health condition. At every step he guides us properly what movements to be done, what not to be done. This is a very rare quality found in a teacher. Really, we should be all thankful to him for this great quality. Last but not the least, though all of us are benefited from our health conditions, I am personally benefited in my medical profession. I advise my patients to apply these simple measures to overcome a very common conditions like a upper respiratory catarrh, common cold, repeated breathing problem. I advise them all the types of pranayama, and like a chronic constipation, Agnisar Kriya with the holding. It has yielded very good results. The quantity of medicine I am prescribing every day has come down markedly. We are very fortunate to be associated with the Nagaraj Institute of Yoga with such a wonderful teacher in Sri Krishnaji Kurti sir. He has a great and abundant patience and concern for welfare and good health of all the people, and his methodical approach to the problems. And to cap all these qualities, he does all these services absolutely free of cost, without expecting anything from anyone. What a great soul. Really, hats off to him and his family members, because nobody succeeds in their endeavor without the help and cooperation from the family members. So here in this context, I would like to congratulate and compliment his wife and daughters and all other members of his family. Though my father Krishnacharya is no more, I pay my reverences to Sri Krishnaji Kurti sir, a fatherly figure. I conclude my remarks with the saying from Ishavasya Upanishad, Bhuishtham tenama uktim idhema. Asmat Guruvantargata, Sri Krishnaji Kurti Guruvantargata, Patanjali Maharshi Antargata, Bharati Rona Mukhya Prana Antargata, Sri Sitapate Ramchandra Prityartham, Guru Madhvantargata, Sri Krishnar Pranamastu, Sri Krishnar Pranamastu, Sri Krishnar Pranamastu.